Hi, this is a patient that came into our sort of central London clinic, and as you can see from the sagittal view straight away, the L3 disc, it's got quite a big prolapse there, and even just here it's even larger, a little extrusion at the back end. Now this patient walked in on crutches. She was in a hell of a lot of lower back pain, and she also had radicular symptoms into the leg as well. Now she had been booked
a large
in,
extrusion. That.
Yeah, she had been booked in for surgery to have this removed, decompression, but she was so scared of having the surgery she looked us up and she went to have the IDD therapy. Now just on first view it's quite a large prolapse and it's quite black as well, meaning that it's quite chronic and it's quite old in nature.
So just to stop you there, would you say that was an extra little new fragment that's come off?
Yeah,
you think?
Possibly looks like an extra little bit that's come out.
Really to do fresh, sort of extra little protrusion.
And normally with IDD, where this is so large, you may not see such great success over a short space of time. Purely because, as I say, the disc looks thickened, fibrosed possibly, and there's not much grey like there is in this one up here, so it's not a fresh prolapse. Anyway, we decided to put this patient onto the IDD, and as you can see in the axial view, she's got a 0.8 centimetre prolapse onto the right paracentral region, which is also touching her right sort of, L5, S1 nerve roots as they pass by.
It's pretty big.
And this patient, in a nutshell, she had 22 sessions of IDD. She was doing on average around 3 or 4 a week, and I mean, she has discharged herself after 22 sessions. She is virtually pain-free. She has no more leg symptoms. She gets the odd lower back ache from time to time, and I certainly wouldn't say that there's no way it's never going to come back again, but based on the session she's had, her leg symptoms have completely cleared up. Now, would you normally expect this, Rob, in a patient with such a large...
Wow, so this one, isn't it? I mean, that is a large, that's a large extrusion.
I mean, what's good about this extrusion, if there's anything good about it, is that there is still a little fine space at the back part here.
Yeah, I mean, but you still expect that to be pinching.
Well, of course, but there's still a potential for a nerve to be, pushed around that space. So any retraction of this may open that up a little further. But
so I suppose you could argue you only need to get a small amount of retraction.
Yeah, but I wasn't thinking
to get a large improvement in symptoms.
But the results we had, I was surprised in such a short space of time.
I mean, like you said, I think if you rescanned this, you would almost certainly expect there still to be a fairly large extrusion, would you not? I mean, not unheard of.
Yeah, I wouldn't expect too much disc material to be going back in.
And just remind me, Darren, had she had, how long had she had her symptoms for?
I think it was 6 months on and off, but I think it was a 3-week period prior that it was just getting to where she was starting to develop foot drop on that right side. Which had all come back after 22 sessions of the IDD.
So the foot drop resolved?
Reduced, yeah, really? Completely, yeah. Amazing. So yeah, it's a good response.
People could argue that she could have had that result without the IDD just through time. What would you have said? What would you say to that comment?
Yeah, well, again, there's always that potential, but the fact that she'd had it for a period.
I suppose you just encourage that better result.
Exactly.
You are having a little bit of increased pressure taking off of the disc. Yeah.
But no, it was a good response. So it proves that certain discs can have that potential to reduce in pain, even if the size remains post-treatment.
Yeah. Okay.
No, it was a good response.
Good one. Thanks.